Worshippers at St. Mary's Catholic Church in Detroit, Michigan today didn't give the sign of peace or drink from the communion chalice.
They asked us not to shake hands, and also we took communion but not the wine.
Churches across the country, hoping to slow the spread of the H1N1 influenza virus, were preaching a change in habits.
Washing your hands and sanitizing them. These are all the sort of things I'm really trusting my parishioners are doing.
More than 20,000 Detroit school children won't be seeing each other for 2 days. Officials closed all 24 schools in one district west of the city today after a high school girl came down with an apparent flu case. That makes more than 470 schools closed in at least 18 states, stranding some 270,000 children at home.
Our current guidance for school dismissals suggests that if there's a case identified in a school population, the authorities consider dismissing the students for a period of up to 2 weeks.
In Cibolo, Texas, where schools were closed last week, officials opted to keep them shut.
We want them to stay home, and when we mean home, we don't mean just not school. We mean home.
Medical anthropologist Ron Barrett says officials are right to err on the side of prudence.
There was a large study done at the University of Michigan that showed that in 43 cities in the United States, that school closures seem to be significantly associated with lesser mortality for that flu in 1918.
To calm nerves, President Obama's health officials blitzed the Sunday talk shows this morning, striking a carefully balanced tone.
The early news seems to be cautiously optimistic about where we are right now. We certainly can't get complacent.
And that's because much remains unknown about this virus, including why it seems to be attacking an unusual age demographic, with a median age of 17. Today, U.S. health officials said while at this point they are not sure why the older population is not being affected as much by the H1N1 virus, they are looking into whether they are protected by years of previous flu vaccines. Russ?
Bianca Solorzano, thank you very much.